Okay, with that, we'll go with Kathy McKay and her group. Jamie, Josh, everybody coming up.
Good morning.
Morning, Kathy.
Thank you for having us again. Cheryl's just handing out information on our latest numbers. And so as you can see, a number of positive cases. Of course, we expect that it keeps going up in Minnesota as well as around the nation. And then we have 19 in Clay County. And that was as of yesterday. So you see the total numbers of those that are tested in Minnesota so far. So the 28,128 that have been tested by both the public health lab and some external labs. So 986 cases out of the 28,128 that were tested. And of course, we have, what, 5.7 million? 5.3 million? Okay, 5.3 in Minnesota. So you see the number of positive cases of 986 out of that 5.3 in Minnesota. So the number is, we'd like to keep it low like it is, so that is absolutely great. The U.S. Cases, 352,000 confirmed, over 10,000 deaths now. And then there's close to 19,000 that have recovered in the U.S. And then globally, it's 1.3 million confirmed, 73,000 deaths. And again, these numbers change daily. So we want to be careful about getting too hung up on the numbers. We were looking back, it was almost exactly a month ago, on March 6th, we had our first presumptive case in Minnesota. So on March 6th, today's April 7th, so about a month ago, that was the first presumptive case in Ramsey County. Clay County had our first case March 19th. So that was our first case that was, which is less than a month ago. So you see how the numbers are comparing to that.
So according to this report, half the people who have tested positive have already recovered.
Yes.
470, you said 470 are no longer isolated. Are they considered recovered, or?
Right, exactly, yes. Who no longer need isolation, 470, that is correct. Yes. And then did I say I think the 30 deaths in Minnesota as well. 223 were hospitalized. So, you know, the exposure, you know, was about travel to begin with. Now, of course, they know it's community spread, so it's person to person. So our message is still the same about social distancing. That is the way we can mitigate this is social distancing. We can't, you know, this is a marathon, not a sprint as they describe it. So we continue to have to implement that, as tough as it is, in regards to, you know, the stay-at-home orders. That's the only way we can, you know, stop this, you know, level of infections going on. This spread, community spread, is from person to person. So if we can break that cycle from person to person, that's how we'll keep the numbers down, and that's how we'll keep the number of people that are infected and develop the actual COVID. So we really are stressing that people adhere to that. Sometimes we get lax and think, well, you know, our numbers aren't that high yet. We have to not get lax. This is a time we still need to continue to, you know, we have to change the trajectory of this COVID. So we do need to, that social distancing is what everyone can do. We need everybody to do that. So 6 feet, if you're out in the public around people. Remember, one of the national experts said, keep in mind, just think about everybody could carry the virus. So 6 feet distancing is how we can avoid that spread. And that's just really important for everybody to think about. Go out in the public if you need to, as far as getting your groceries, essential things, your medication, but keep that 6-foot distancing. Some of the places actually have marks in the grocery stores where, you know, if you're standing in line, you can see where the 6-foot distancing is. Others do not. Some of the establishments are limiting the number of people that are coming in. But we really just keep that in mind. We don't want to be lax about that. That's a very important thing that we all can do. I know we talk about it all the time, but we need to really stress this has to continue. We have to continue this for a while. The governor's stay-at-home order was through the 10th, which is Friday. He hasn't determined yet if he's extending that and what that will look like. I suspect there will be some extension to that. So I'm sure he'll be announcing that soon about what will happen after that 10th about stay-at-home order. We really need people to adhere to this. It's very, very important. So that's the message. Everybody has to do their part. We as citizens in the community can change the trajectory of this virus. We can, because it's person-to-person spread. So let's really adhere to that social distancing. That's just vitally important. I know I've said it about 16 times now, so we just want people to be mindful of that. They also
Excuse me.
Oh, yes.
I saw Cheryl pass out on a thing on face coverings. What's your opinion on that?
Yes.
Are you going to get to that yet?
I will, right now. Thank you
Excuse me.
for noticing that. So the federal government put out for a while they were saying, you know, masks for those that work in healthcare particularly, because the shortage of N95 masks and surgical masks is evident across the nation. So we still want to keep those masks for those that are really directly working with those that are ill, like in the hospital settings, healthcare workers. But the federal government put out just a thing about masks. So now they say if you want to wear a mask if you're out in the general public. Now keep in mind, these would be homemade masks. We don't want people to try to be searching for the surgical masks and the N95 masks. So they can be homemade masks, but they are a secondary protection. So we've got Vanna and Vanna showing the masks. The primary protection, of course, is hand washing, covering your cough, social distancing. Now, if you get a homemade mask, which we had some of our retired nurses make, those are to protect other people. So you wear a mask, you're protecting you might have the virus, you're protecting spreading it to another person. These masks are not going to protect yourself. They're going to protect everyone around you. So it's not essential. They're not requiring you to wear that. There's a lot of discussion about that. But it's not a substitute for social distancing. We don't want people to think I have a mask on, now I can get closer to people. That's not the case. It is wearing the mask so you, if you're a carrier, will protect the people that you're encountering that may be closer than 6 feet to you.
How do you contact? I mean, it's protecting the other people. So if I'm spreading it and they have a mask on and I have a mask, or don't have a mask on, how do they catch the virus? I mean, what is it they catch the virus from?
Well, the virus are droplets, so respiratory droplets. And again, that's why they can, we want to clean surfaces, because if I'm coughing and I have COVID, I can have droplets that land on surfaces. But it also can land person to person. So you'll get it if you get it in your eyes, nose, mouth, the droplets can spread. That's why we say 6 feet. So you can, the studies have shown, as best as they can study this, that if you're 6 feet and further away, the droplets won't necessarily reach you. So if I'm further than 6 feet away, I'm coughing, I have COVID, my droplets aren't going to reach you. They will if you're within that 6 feet, they can. But 6 feet and over is the protective area. So if you're wearing a mask, you might be a carrier because you might not have symptoms. We can carry the virus, and they're estimating about 48 hours before you actually even have symptoms. So we can be carriers. We didn't even realize we have it yet. We're not ill, We might have picked it up from someone else. So that's why the masks are, I might be a carrier. If I wear a mask and I get closer than 6 feet to people, I can protect those people from my virus that I'm spreading.
Thank you.
So it still doesn't take the place of social distancing. It does not take the place of washing your hands. That's why it's not mandatory. It's optional. It's just another way to protect. If you are out in a crowd, then you can protect people from yourself.
Very good.
Does that make sense? Okay. I'll have Cheryl talk about essential services in a second, but I wanted to also note that we had a conference call with our hospitals on the Fargo side. They wanted to just update us on, they've been working on surge capacity plans. So what will happen if they're full in their hospital settings? What is their plan then for dealing with, on overflow of that and the number of COVID cases they may see. So they've been working on this for quite some time, and they have plans in place for if they have overflow, where will people go? So they're working on those kinds of plans. They're working on getting supplies and equipment. Some of that will come through the North Dakota state cash. Some of that, if they need a lot of ventilators, everybody across the nation is looking at ventilators. If they need those, they'll have to determine when and where they can get those. So they're ramping up in the event that they're going to be overloaded with cases. So they just wanted to update. I know Commissioner Haney was on there, and our county administrator and the mayors and some others. They just wanted to keep the communities informed about, they have plans and they're working on those. Sanford also has implemented a rapid test for their high priority patients. So this would be the COVID test. They can do it in 90 minutes, or the results come in 90 minutes. And it's really for those that are hospitalized, healthcare workers, and those that are in congregate care living, like the long-term care people. This test is available now in Fargo, at their Fargo location, and also at their Sioux Falls location. So that's a good thing, that it's only going to take 90 minutes for those that are in the high priority categories. So that is a positive thing. We're still working on our plans for what if we get a case in our detox facility, and then also for the homeless population. So we're still working on those plans as well. I'll let Cheryl talk a little bit about what we call our task to provide essential services.
Good morning. So Minnesota Department of Health is doing the monitoring for people that are positive with COVID and they're recovering from home. They're also monitoring basically the contacts of that positive person. So when they get notified that a person is positive for COVID-19, they call that individual and find out who their close contacts have been, which would include most likely household members, if they, their employment, if they have close co-workers there. So they're calling them twice a day and asking them to check their temperature and everything. And then they also let local public health know if this individual is at home and they have no transportation, they need some essential items such as groceries, or they're unable to get medications delivered that they normally take. That is where local public health jumps in to assist, to make sure that these individuals within our county that are being monitored for isolation and quarantine, that we can make sure that they get the items that they need. Right now we have 3 individuals that we have been contacted. They send us an encrypted email and let us know who those individuals are, and we are very careful to protect their privacy, as we have been directed to do, and we give them a call and check and see how can we help you. So we have some of our public health nurses that are compiling a list of grocery stores that are able to deliver, pharmacies that are able to deliver, and the area that they're able to deliver in, since We know at some point in time, we could have individuals up in the Ullin-Hitterdal area that may need some items. So we're putting all that plan together so that we can work together to make sure that our Clay County individuals and citizens are taken care of properly.
Okay, thank you.
Any questions about any of the information or anything
No,
that,
very good update so far, thank you.
okay,
The other
That's
two get
all.
to speak too?
anything?
You just came to say hi?
Josh, anything? No? Okay, I
All
guess
right.
that's it.
No, thank you so much for that update, it's very
Thank
good
you,
information.
thank you.